How do you know when your dog's had enough life? This is a tough question. We're going to get into that today. And we're going to also include ways that current veterinary medicine models are actually causing confusion. We're going to talk about key points to look at, how you can know what your pet really wants. I'm Dr. Christina, the owner and founder of Gentle Journey, the first in-home euthanasia service here in Arizona. And after 20 years of working with pet parents and their pets at end of life, I've learned a lot that I was not taught in vet school. I've also watched patterns and things we're doing in veterinary medicine with good intention that are actually causing more confusion, guilt, pressure, sometimes judgment. What are those things? Well, let me start by giving you a little history. When I was in school about 20 years ago, we weren't quite sure if animals felt pain, believe it or not. This was a debatable topic. Now, luckily, I went to a very progressive school, Colorado State, where we were on the forefront of fighting to prove that animals do feel pain. Fortunately, I went to a school that was progressive, Colorado State University, and we were on the forefront of the movement to teach the public that animals do feel pain. When I came out of school and had my first job, pain medication after surgery for dogs and cats was an optional element on the estimate, which means you could save money by choosing not to give your pet pain meds. We've come a long way since then. But I want to talk about how did we get to that point? How are we ever at that point? It seems astonishing, doesn't it? And over the years of working with clients, I have a better understanding of how people can legitimately get to that conclusion. Because I see people regularly with pets that have serious diagnoses that show me subtle signs of pain. And I talk to these pet parents and they are absolutely sure their pet does not feel pain. And I started realizing these people who love their pets, who don't believe their pets feel pain, are seeing the same things that scientists were seeing years ago. They weren't bad people. They weren't cruel or just completely disconnected. They were seeing happy, friendly pets. Dogs that wag their tail, that smile at you, that look interested when you come home, that want to go on a walk even if they can't make the walk. They look like they want to go on a walk. Who wants to go on a walk when you're in pain, right? That's the reasoning. So this dog must not be in pain. This cat must not be in pain. He wants to sit on my lap and be pet. She really loves her treats. She must not be in pain. This is the way we reason out whether our pets feel pain, and we're wrong. That was all part of the teaching I learned in school to help overcome this idea that animals don't feel pain. I can now use daily with my clients to help them see their pets feel pain. So how do you know if your pet is in pain? It can be very confusing. And I know that you want to do what's best for your pet. And so learning a few key indicators can help you know better. One of the first things I was taught is if an animal was diagnosed with something painful, just start by assuming there is pain, right? We know from human patients that cancer is very painful. So we need to assume that an animal with cancer diagnosis is in some level of pain. Now, you may see behaviors that make you think he or she is not in pain. And I want you to remember those scientists who were so sure that animals after surgery did not feel pain. And this is why when we see pets, we think they're not in pain, but they actually are in pain. So what are the signs to know if your pet's had enough of life? Well, first start out by thinking about how your dog or cat has been their whole life. Each individual dog or cat, despite the breed, has their own personality. And you know whether this is a fighter. You know whether this is a pleaser. You know whether this is a pet who doesn't normally like to be touched even on its best day. This is an important starting point to know what your pet's normal is. So all of you who are watching right now, who maybe your pet doesn't have a bad diagnosis, start by really paying attention to what your pet is normally like. That's going to help you tell when things are just slightly different. We have to be careful about desire versus ability. Maybe your pet still has a desire to eat. Your pet may still have a desire to play or go for a walk. Now ask, what is their ability to do that? Do they take a couple of bites and then walk away, which can often be a sneaky sign of nausea? They're hungry. They just get nauseous. They're hungry. They may get painful after eating. Or they may have a limited appetite. All of these are possible. So we have to be careful that we don't over-evaluate desire and we're actually looking at ability. Are they able to eat? Are they able to keep on weight? Looking at their body condition can tell us so much more than their desire to eat. Their desire to walk may get us confused, but do they get out of breath quickly? Sometimes being out of breath and panting heavily can be more a sign of pain than not having the endurance. Sometimes we think, oh, they're just weak, they're getting old, they're out of shape. Sometimes pain is why they start panting or slowing down on a walk very quickly. So you want to look at their ability. How well are they able to do it? Do not look at their smile. Do not look at the tail wags. They may be excited to go on a walk. We have to look at their ability. The other key indicator is sleeping. When we're in pain, we cannot get good sleep. When our pain is being covered with good pain medications, we sleep deeply. So we want to make sure, are our pets sleeping well? Are they sleeping through the night or are they restless? Restlessness is one of the most common signs of pain. They can look anxious and needy. So you want to read between the lines. And just because you're giving a pet pain medication does not mean you're covering their pain. Have you ever been on a pain medication that hasn't worked? I have. I don't just have experience in veterinary medicine. I also have personal experience with chronic pain. And I have been prescribed gabapentin, the holy grail of pain meds these days. And for my own personal pain, it did not help. And it's a reminder to look at whether the pain meds are working by looking at these key indicators. And the best indicator is how well is your pet sleeping. If your pet is resting, lying down with their eyes wide open, just staring into space, that's actually a position of pain. They're just trying to cope with the pain. They can't really do anything and they can't really sleep. So we want to look for sound sleep. And when they're sleeping, nice, slow, deep breaths. These are clear indicators that cannot be overridden by their wonderful, joyous personalities. There's a reason we love pets. They have the ability to be so present and find joy in every moment, even one where they may be suffering, which might seem contradictory. How can you be experiencing joy and suffering? And maybe it's shifting on and off. Maybe you see a moment of joy, but maybe you also see moments of suffering throughout the day. Make sure you're paying attention to those. A sign that a dog has had enough of life usually looks like a tired dog. Usually looks like a dog that may be soldiering on versus really actively, energetically being involved in the activity that you are asking them to be involved in. There's more hesitancy, pauses, just random pauses when they're walking across the room, random pauses when you take them to the park or their favorite place, and they just kind of stop and stare. These are signs that they're trying to cope with something that you may not be fully aware of, or maybe you are aware of what's going on and they're telling you it's getting to that point. It's a very personal decision when to decide for your pet if they've had enough life. Rather, give your pet permission to go with ease, because suffering does increase at the end of life. and progresses and even accelerates. It's a personal decision to think about how much life you want to continue to give your pet, but also how much suffering are you willing to allow your pet to get into? This is a very difficult question, and you don't have to do it alone. Honestly, I recorded myself because I was saying the same thing over and over. There are just some basic things that every client, every pet parent needs to understand when we're talking about quality of life. And I saved myself time by recording this video. So every client of mine gets this video to watch before we meet. You can access this video online on my website at gentlejourneyaz.com. And once you watch the video, you also can request a consult with me online, either virtually or if you're in the Phoenix metro area in your home. You don't have to do this alone. I'm here to help you make the best decision for your family and your pet.